EBOG.
Okay, perfect. And so we will start seeing people joining the call. Thanks for being here, everyone. We will get started in just a minute. And as the webinar is letting people log in, because this is a recorded event, I am going to start with our introductions and greetings, and then we will get into all of our topic discussions for today. Greetings, everyone. My name is Ren Lovegood. My pronouns are they, them, and I'm the Senior Manager of the Leadership Excellence Networks, which is also known as LENS, here at NCHL, the National Center for Healthcare Leadership. Thanks for joining us for January's coffee chat. It's part 2 of tapping into talent, supporting persons with disabilities through the talent, the HR life cycle in partnership with Sodexo. And before we get started, I have a few housekeeping items to note. First, if you have a question or a comment for the panelists, please submit it directly into the Q&A section of the webinar. While we are going to try to hold time for questions, should we not get to them, this will allow us to address them offline following the completion of the event. We are recording today's session. It will be available on our YouTube channel within 3 business days. The link to the recording will also be sent out to all registered attendees. To increase event accessibility, we are utilizing Zoom, and I've enabled the closed captioning feature. Should you wish to enable this on your own computer for today's event, please click on the closed captioning buttons on the bottom of your Zoom window webinar. And NCHL promotes values promoting diversity and inclusion through equitable access to our events. And so we would welcome feedback regarding ways in which we can improve accessibility. We'll send out a survey after today's event for your input, so that we can best serve you in our coffee chats moving forward. A warm welcome to our panelists. So joining us today are a team of leaders from Sodexo, including Karen Dutton, a director of DE&I, Gloria Puentes, director of Global Diversity and Inclusion, Lauren Reardon, director of Guest Services and Service Excellence at Winchester Hospital and Sodexo, and Rhonda Bradley, Human Resources Manager for Sodexo. Sodexo has a long history of championing equal opportunity employments for people with disabilities. The second part of this 2-part series today will discuss strategies that these leaders with us are using to increase equity for persons with disabilities through the HR life cycle. We're going to focus today on specific strategies that you can incorporate into your onboarding and retention efforts to increase disability inclusion. And again, we welcome you to share your own strategies or questions regarding recruitment and hiring in the Q&A through today's event. And so without further ado, Karen, when we were prepping for this, we had a really great conversation about a training that you do to help new hires understand their own implicit biases and how that might pertain to the experience of a staff member with disabilities. How have you seen this come up specific to disabilities, and what success have you had with it?
Thank you, Ren. It's such a big topic. I think we could take the whole 30 minutes talking about this, but and I asked my panelists to also weigh into this conversation, but it is so important that we have this culture in the organization. So from our recruiters to our hiring managers to new hires joining our organization, it is our culture to work human and to recognize what everyone brings to the table, and really recognizing also how hard it is for people with disabilities. And you think about the whole intersectionality of that, minorities with disabilities, LGBTQ+, people with disabilities, and just recognizing what people can do. But you also have to go and have resources available or tools available, training available. So whether or not it's through facilitator-led discussion or your own self-learning, to raise your own awareness, like what biases do I have, right? So when I look at someone, do I make decisions based on that iceberg, what you see and what you expect someone to be able to do, as opposed to what they can actually do? So it's the training that happens with hiring managers, recruiters, anyone in that employee life cycle, but also having resources for new hires to come in to understand what the culture is at your organization. So anyone else want to add to what I'm saying? Thoughts, Rhonda? I think I saw you were going to light up there. What are your thoughts?
Oh, yes. I definitely agree with you, Karen. The focusing on training is so important because we've got to make sure that we're not tiptoeing, that we know how and what we need to do to make sure it gets done. So a focus on training and management staff makes everyone bring in that humanized feeling of that individual is no different from anyone else.
And I think Rhonda too, I think you said this before in our last session, it's about, in Red too, we all discussing this, it's about asking people what they need to be successful. Don't make assumptions, because we all should be asked that question, but specifically people with disabilities, we think that, well, they can't do this and they can't do this and they can't do this. And I can remember one of our team members, it was a frontline team member, very important position of being able to be in the dish room washing dishes. And this individual was legally blind and sight impaired. They were so successful, but they said, this is what I want to do, and this is what I need to be able to do this job. So make assumptions, ask, talk.
And in my experience, this is Gloria, and in my experience, it's interesting because sometimes it's the teammates who say, we want to learn more about a specific disability so that they can then be able to support their colleague. And that's when you know that you have created that inclusive culture, when they want to be a part of helping one another be successful in their role. And I have seen that at several different sites, and it's just a wonderful thought that these that the colleagues are coming forward and saying, oh, can we get training on this, or can we get training on that, so we can help them be successful. And it's also good in my experience in placing them through our partner organizations, when there is a job coach with them to help them start the process and are there with them from the beginning to make sure that they are successful. And then they come back periodically to just do quick check-ins. And that's very helpful, not only to the individual who has been placed, but to the team members as well, to see that they have, that there is this type of support for them.
Gloria, I love that you said that, because in the real world, so I do employ several individuals with disabilities, and a couple things that you said definitely ring true. So, upon the early stages, I'm thinking of an individual that's worked with our team for 21 years. In the initial stages, it was the job coach that came in quite frequently. And then, and that's great for certain things, but then it's really about the team embracing what this individual needs. And then those periodic check-ins, and also involving the families who sometimes do want to get involved, and they can help us really understand that individual. They know what makes them tick. And then I love, fast forward 21 years, having their colleagues speak up and say, if it gets really loud, or in this case, it's a hospital, it's tray line, we're really busy and it's a high census. If we show any panic, that individual can't, it makes it harder for that individual to succeed. So everybody knows, and then they come and talk to us. So everybody looks out for each other, but that's creating that inclusive culture that does take a little while to build. And it's, once you get the commitment, I love, and I employ a lot of younger individuals, high school students, and they have really stepped up and really help out their coworkers a lot with this. So it's a great learning for all of us, but it's a constant learning. Just when you think you have it figured out, the needs might change. COVID changed everything. Just where the ability to wear a mask and work in this environment has changed tremendously for several individuals. So I think it's being open to change.
And Lauren, I would like to add, because I love what you said too as well. This is a very precarious time, and we are coming up against various challenges. And we've had some of our units in the Gulf Coast as well. We had an individual that was hearing impaired, And the teammates, from what the managers and hiring managers are saying, they really embraced and they wanted to learn sign language. I mean, it was something that they wanted to make sure it was an opportunity for them as well to help their coworker and become more inclusive. So this is now more of an open time where we are just, embracing and being very open to say, hey, I want to learn too and help and make everyone feel great to work here.
Rhonda, I
And
want
just-
to add that. Oh, go ahead, Gloria. I'm sorry.
No, go ahead, Karen.
No, I think that it's also, in our pre-conference, we were all talking about people asking questions and you just like want to say, why did you ask that question? I think that when we're training and when we're having dialogue and conversations, we need to help people understand how to frame the question the right way so that we're not putting something else on the defensive, that we're really including them. And I think with training with the staff at all levels, they have to understand, but if you say it, if you want to say it this way, open the question, but let's talk about a better way to say it, giving them those tools to open conversation, because many people are afraid to address someone's disability because they're afraid of saying the wrong thing and offending. Gloria.
Yeah, no, what I was going to say is oftentimes when the colleagues are coming forth and asking for additional training, they're getting that because it is an inclusive environment. But that inclusive environment, it's not up to those of us in DE&I or those just general manager, just the general managers or the front line. It starts from the top down, bottom up, in, out, in. It's like it's the responsibility of each and every one of us. And so when our colleagues are asking for that additional training, for that additional support, it's wonderful that we can provide that.
I would also add to part of our role is to advocate within our organizations that we work in. So these individuals might work within a specific department, but it's educating the rest of the organization, the acceptance and the willingness to learn and meet people where they're at. So I'm fortunate to work in a culture that we have that culture, but sometimes that's a little bit of a change. And as new people come along, to orient to this is our culture and we are inclusive and here's a couple tips, so I think that makes a difference. We have an individual that's very affectionate. So, again, sometimes it's, just how do you meet this individual where they're at, and you can have a conversation with them, you know what I mean? But don't just go to judge. That's
Right.
Right.
So
Other
Lauren, I want to ask a question of Lauren, because you with your influence and your sphere of responsibility within the organization. So it used to be very difficult for people with disabilities to break into being a doctor or a nurse or a technician, those really professional positions. Do you see that changing in your organization, that there's a welcoming environment for people with disabilities at those levels and those types of roles?
I do think there's a welcoming environment. I think there's a lot to improve and to see more individuals come into these fields. But I know that, we've had, several individuals come to mind over the years with minor kind of disabilities, but I think it's very inclusive here. But I'd like to see more in those roles. Again, traditionally, it's in our housekeeping, food service level roles. But I think what we've taught is they don't, these individuals, just because they have a disability or something, they don't have to just be in a dish room. They can go up to the floors. They can interact with patients. We just have to give them the support to succeed. But I think it educates the rest of the organization to think differently when I'm going to hire a nurse or a nurse's aide or whatever.
Yeah, I actually, Lauren, one of my children is an ICU nurse, and I asked her this question. She's 27 years old. I said about people with disabilities in the nursing profession. She said, Mom, I have 3 people that I know, and colleagues that have a disability, and it's very open about it, very accepting in that organization. So I think it's slow, but we're moving in the right directions when we think about those professional positions for moving into management directors.
Absolutely. Yep.
I think I'll add that. I think my favorite onboarding strategy, which is so simple and non-polarizing, is for either hiring managers when they're providing a job offer, or even before someone might disclose whether or not they have a disability, is normalizing asking everyone, every new employee, are there supports you might need to help you be more successful in your role? Is there certain software you use, or certain things that would help you to be successful? Because I think a lot of people who qualify for accommodations or benefit from them maybe don't actually consider themselves to have a disability. I think of things like migraines, right? Maybe certain lighting, you might have a day where you have a debilitating migraine, and an accommodation might be that in your office there's a space for you to go that's dark, or that will give you, some time to try to alleviate those symptoms, and isn't going to be disruptive of the day or even cost anything. Or even people who live with dyslexia, who may have issues with spelling, but they can use talk to text software or read aloud software to make them more efficient in their role and feel supported. And because the vast majority of accommodations don't cost anything, are already kind of built into our computers and things, and then those that do, majority of them cost less than a couple $100s. So this creates that psychological safety right off the bat, to say, not even asking if you have a disability, not even asking for disclosure, just, are there any supports that you as a person might need? And this then opens up past disability, right? So if you're a person who just had a baby and you need access to a lactation room or breaks for that during the day, if you are a caregiver and you might need support at certain times, or flexibility to be able to go and take care of a family member who's not doing well, there's all sorts of different life experiences outside of disability too that might be deserving of those extra supports built in, right? And so it creates that psychological safety and that feeling of support from the very beginning, and can really, I think, create the relationships right off the bat with hiring managers or with the organization, that are going to say to new employees, oh, this place really cares about whether or not I stay, and whether or not I can do well here, and whether or not my experience as an employee is good. And that is one of those strategies that costs nothing at all.
And generally benefits everyone. Those
Yeah.
accommodations that we think benefits everyone. So wouldn't someone who maybe doesn't suffer from migraines just need a moment to be in a space where they can have calm time, right?
Right. And sometimes, Karen, those accommodations are not just, I think managers may be afraid of, oh, well, what is it that they're going to need or for this particular job? But first, you have to understand and have those conversations with the individual. And when you are being hired, it's so important to go through that job description, so you can really understand the need, and then that gives you an opportunity to, okay, can you do it, take a 30-minute break, or what do you need, and understanding for that person too what's needed for that job. So that keeps the manager from not managing the disability, but just continuing to managing the job task, so they won't be afraid to hire the individual. You must have that understanding from the beginning. And I think that job description plays an important role in that.
Ren, we, as was mentioned in the last call, I manage all of our external strategic partnerships and work with many, many different organizations that are serving individuals with disabilities. And so when in our program, our workforce initiative, we have an applicant referral form, and in there, it gives the partner the opportunity to say what accommodations might be needed. So that from the beginning, from the interviewing process, and then through, we are already made aware. And so that has been extremely helpful, because you're not going to interview an individual who is from the neurodivergent community,
Right.
to the same way you would someone, who doesn't have an intellectual disability, right? And so when we're made aware of that, we can let the hiring manager know and others know. And that's very helpful. But something else that we do, and I don't recall if I mentioned this in, last month, but we have, now that COVID we're living in the new COVID period, we are inviting our partners to come to various sites to take a look at what the site is so that they can recommend who is best suited for the environment, the culture there, to make sure that if someone lives with autism, that there's a place in that site where they would feel comfortable. It maybe is not perfect, but they're already helping us to help them to be successful in their placement.
And those strategies have worked for us that Gloria is speaking about in the Gulf Coast. We actually have those pre-screening calls to go through those accommodations. And then once we have the pre-screening calls, the hiring managers will invite everyone out and they get a chance to visit the units as well. And it just makes more of an inclusive environment when we utilize that process. And the hiring manager can actually ask those appropriate questions, and the person with disabilities can also have an opportunity to ask questions as well. We also invite the job coach to the orientations too. That's something else that we do that we found that has been very successful too. So they can help understand the culture and what the expectations are as well, and help guide that individual with what's needed.
That's exactly what we do here as well. The job coach and the individual, they tour, they shadow some of the positions, and just see if it's an environment that they can succeed at before we move forward. Yep. Very helpful.
What we have also found is that a number of the job coaches then will create maybe the flashcards or whatever is needed to help the individual to be able to be successful. So
Gloria, I just have a question for the listeners that are on the participants that are out there. They may be coming back and saying, oh, I don't have a partner in the community that I can reach out to. So what recommendations would you have for them to get started to look for those partner organizations that can help bring people with disabilities into their organizations? What recommendations would you have?
Gosh, there are several national organizations that we work with that can be found in almost every state. And I would say go to those like the vocational rehab agencies, look online for Best Buddies or the ARC, or those are just several organizations that are more national in scope. There are a lot of individual local to a specific region, say Atlanta or Boston or Chicago. But that's what I would recommend as now, Karen.
Excellent.
Yeah, I think just piggybacking off of Gloria, things like the Commission for the Blind, I think a lot of there's state-run kind of organizations as well as federal departments of mental health, right? Will do a lot of job coaching and placement and support. And so it might depend on your state, but there's definitely partners available close by. But this is a good segue too. I know, Lauren, something we had talked about when we were prepping was that you've been at Winchester Hospital for a long time and you've built up a really strong management team who has, integrated individuals with disabilities and a variety of different identities into your workforce, and has been provided kind of the tools long-term to understand how to provide accommodations and how to support and individualize those supports for employees. And as you brought on a newer manager this year, they had that success in terms of being coached and individually trained and having these mentoring relationships from people who have already had great success with implementing programs like this. And that what you're also finding is that there's secondary barriers to retention that maybe aren't actually necessarily related to disability. They may apply more broadly, but more often happen in the disability community. Could you talk a little about those things?
Sure, thanks, Ren. Yeah, we have a new challenge that we've faced, and probably in light of what's going on in the economy, and where we are located. Winchester, Massachusetts is, for those participants that don't know, we're about 11 miles north of Boston. But we are not on public transportation route here. The hospital probably is about 1.5 miles from the closest train station. But what we're finding is a lot of transportation issues. As we know, purchasing vehicles is extremely expensive. It used to be you could buy a used vehicle and that was the way to go, and now that's out of the question. In addition, just the price of everything. And we just recently did an assessment, and I thought I had a pretty good handle on all my employees and who's doing what. And we have 1 or 2 walkers. Well, no, we have 8 people that were walking. And again, Boston, it's not, today's a great day, it's 40 and just raining, but normally there's a lot of snow on the ground. So really trying to work with our local community leaders, our hospital. We're lucky in this organization, the security and shuttle drivers work with us to try to accommodate as best they can. And we're all trying to pull together and get these individuals the resources that they can, because they can't afford Ubers to succeed to get to work. And then the other issue that we have come across as well is, again, a lot of our workforce is coming in and English is not their primary language, and not even, they don't know it at all, but yet they want to work. And so English as a second language, enrolling them in classes, tapping into our resources, but really trying to meet people where they're at and provide them the right resources to be successful. And instead of saying, not giving them a chance. So just new workforce challenges that I'm sure everybody on this call is encountering.
It's new territory to conquer, but I think some creative problem solving and teamwork, right? There's a lot of opportunity there to make the employee experience more equitable for everybody.
And
And I
involving
know-
local communities. We
Yeah.
reached out to a local chamber of commerce. What are your plans for transportation? And they're working with us on it and saying, okay, if we can get the bus to go to this location, would your shuttle bus meet us here? Things that they haven't considered, but it's getting support from our organization and then local support, because this hospital is a community hospital, so we all have to work together.
And Lauren, to that point, it's interesting because since COVID, I mean, there have been challenges, for when it comes to work for many, even pre-COVID, but most recently, we are finding more and more folks, especially out of metropolitan areas, outside metropolitan areas where public transportation is not as readily available.
Exactly.
So what I have experienced recently is I've had several organizations say, Gloria, if your locations can hire 3 or 4 people, we will transport them there. So now we're sharing that as a benefit to working with various organizations. If they're saying, we'll provide if you hire X number.
Yep.
And that's a great idea. But again, it's not everywhere. So it's a challenge.
It is
And
a challenge, and it's a great idea, especially being in Houston, the 4th largest city. You need all of those types of alternatives for our employees. So just reaching out to the community and having the support of the leadership that, to provide that type of environment is very important, because once the word starts getting out that, hey, this is what this company does at Exodus, you'll start getting more individuals and everyone will join in as well. So that is something that's very important now.
So Ren, I think we're getting close to being on time, right?
We are close to time. I'm wondering, because I think employee resource groups are such an important aspect too of long-term retention. And I'm wondering, I know that Sodexo has built out this really strong employee resource group. I mean, multiple, right? For a variety of people from different identities, but for disability in particular, I believe it's called SOAR. And I was hoping we could maybe give everyone just a quick recap of kind of what SOAR does and how they provide resources to the Sodexo community and your partners in a way that facilitates, I guess, engagement, retention, employee, happiness, well-being, all of those things at work.
Karen, do you want to answer or do you want me to?
Gloria, go ahead.
Okay, great. Thank you, Karen. And thank you, Ren, for that question, because we are very proud and excited to say that Sodexo has 9 employee business resource groups. And to your point, it is SOAR that focuses on individuals with disabilities and their allies. And it's like all of our employee business resources, we're there to provide support, to provide resources to individuals who identify and or who just want to support others from that community, if you will. And so we present speakers. We engage outside organizations that serve this community. We provide them resources. And then our employees even volunteer to do mock interviews with some of our key partner organizations. They speak on panels like this to the constituents of those various partner organizations. And they can be and have offered to be a resource to our employees, who may as a resource to them to say, hey, let us help you. If you have questions, come to us so that we can provide you support. Anything to add, Karen, Lauren,
No,
or Ron?
I just really firmly believe in that. And then the involvement that the SOAR members do in their community, that they're
Yes.
working with those local agencies to provide, not only provide resources, but they're actively engaging. I'm thinking of, the Special Olympics. They're out there, they're in the fields, and they're volunteering because it's important to them. So,
Absolutely.
Ren, back to you.
And so thank you all again so much for being here today. We will be sending out the recording of today's call. We know this is a really hard topic to cover in 2 short 30-minute sessions. Please reach out directly to us with any questions, comments, or resource needs. If we can support you in any way, we'll work on sending out some additional resources as well as a follow-up. Keep an eye out for announcements for our next coffee chat in March, and we are looking forward to partnering with Sodexo again and with all of you into 2023. We hope you have a beautiful rest of your day. Thank you so much, ladies, for joining us. It's always such a pleasure to get to spend time with you.
Thank you, Ren.
Thank you, Ren. Thank you, everyone.
Bye-bye, everyone.
Bye.
Bye.
Everybody.